Mammary glands, which make up a majority of what is found inside of breast tissue, is actually consisting of about 15 to 25 lobes. These kind of subdivisions or breakups inside of the actual breast. Now, what's kind of interesting about that though is those are actually modified sweat glands. So the milk production that comes from mammary tissue is actually a modification from the sweat glands that we have throughout the entire body. Now, there are suspensory ligaments that are going to help hold these lobes in place, because these suspensory ligaments are going to anchor the breast tissue or the mammary tissue to the underlying musculature tissue. Think pectoralis major, for example. It's helping to hold the tissue in place. Now, inside of the lobes are these lobules. The lobules contain alveolar tissue. And that alveolar tissue inside the lobules that will produce the milk. So here we have a view of an anterior view and then a mid-sagittal view of an artist rendition. You can see it showing the skin's cut away. You can see the musculature is behind it. But you can also notice this white tissue that's going back. That white tissue is trying to show the suspensory ligaments. It's showing how it's being anchored to that underlying musculature tissue. But what you can see is the individual lobes. Each one of these brackets, 1, 2, 3, and this one, here's a cut open one, 4. Those are the individual lobes that are inside of that mammary tissue. Now, they'll all radiate away from the actual nipple, which is the opening. So as they do this, they'll go left, center, up, right, down. They'll go all around. It's creating a full 360 away from the center open points. Now, inside those lobes are the lobules. You can see the individual circles. Those are the alveoli. So inside each lobule, you have the alveoli, which is what will produce the milk. From that point, it goes to this lactiferous duct. That's this duct that's leading away from each one of the lobes. From the lactiferous duct, it goes to the lactiferous sinus. That's this area right here where you can see kind of a bulge in the actual duct, lactiferous sinus. That lactiferous sinus goes right to the opening of lactiferous sinus. That's basically the opening is in the nipple. The nipple is the middle part, is going to have multiple different openings from the different lactiferous sinuses. And that's usually right in the middle of the actual areola itself. So all this tissue is being anchored in place, producing milk through these tubules, and then the lactiferous duct to lactiferous sinus, opening to the surface, which is where the nipple is located. Now, unfortunately, though, we have to talk about breast cancer, because it'd be great if nobody ever had to worry about it, but it is something that we have to look into, because unfortunately, it is part of life. Now, hopefully, most people don't have to worry about this, but having early detection, trying to be able to look and be aware of what's going on can help out. Now, usually it's going to arise from epithelial cells of the smaller ducts. So those ducts that are inside the mammary tissue, those epithelial cells, that's typically where it's coming from. About 10% of the cases of breast cancer are hereditary based. They come out of mutations from the BRCA1 and the BRCA2 genes. Now, this doesn't mean that if you have that mutation, you're automatically guaranteed. There's a lot of different factors that go into it. But that's one thing that sometimes is looked into if those gene mutations are present. Now, the risk factors, and while these are risk factors, there's no set reason that means if you have these, you have to get breast cancer. So early onset of menstruation or late cause of menopause. Those can sometimes lead into, or at least cause a concern to be a little more monitoring. You then have no pregnancies, or the first pregnancy is very late in life. That can also be something to say, hey, you know what? Keep a little closer eye here. Or if there's any family history. And that goes for any cancer, not just breast cancer. Any family history usually causes a little more of a cautious watching. But about 70%, even upwards of 3/4, 75% of women don't have any of these risk factors. So that's why it's so important for early detection, self-examination, mammograms. And depending on when mammograms are recommended to start, depends on each individual woman. There are different things that will alter the time frame when that first mammogram should occur, whether through surgeries or family history or several different other factors. So that's the best thing to have discussion with your doctor. Now, treatment's going to depend on what type of lesion is found. Is it going to be radiation? Is it chemotherapy? Is it surgery followed by radiation or chemotherapy? So they'll basically test the lesion to try to see what it is and then figure out the best course of action at that point. Because they'll look at the cells and see which ones they respond to, and then you'll have those options presented. Now we're looking at a mammogram. This one right here is showing a normal scan. You can notice how there's a little bit darker and lighter blue areas. This area right up here is showing a little more tissue density. The lighter blue areas back here is showing less density. But that's all within normal realms. This one over here is showing the detection of a breast cancer lesion. You'll notice it's in yellow. Well, that's a false coloration, but they'll notice that the actual cancerous growth is going to have a higher density on the scan. It'll be denser than any of the white over here, which means that increased density can show up and that can then be used for further examination. A lot of times a biopsy would be followed to test what type of tissue is there to make sure, is it malignant, is it cancerous, or is it not? So a little about mammary glands as well as breast cancer.